Hi, it's Brain Bites with Dr. B. Today I'm going to be talking a little bit about some novel ways that we can treat depression and postpartum depression. I'm talking about neuroactive steroids. So, this is something that some people may not be aware of because it's not readily available yet. So, I'm going to talk about two specific treatments. One is available right now through a very restricted prescribing program, but it is available. And the other is one that's still in clinical trials but is showing great promise. So, the reason I want to share this more than referring a client, because it is so hard to find availability right now, it's just something that's so exciting about medicine and especially for mental health because we're finding these novel ways to address problems that may be way better than what we're doing right now. We commonly prescribe SSRIs, Zoloft being the most prescribed mental health medication in the United States right now. So those work on the serotonin system. We think that also dopamine and norepinephrine are part of the problems that we see with depression and even anxiety. There's some thoughts that stress can also precipitate some depressive symptoms. So things that are related to cortisol, which is related to something we call the HPA axis or the hypothalamic pituitary adrenal axis. So this is something that has a lot to do with the stress. And so any alterations in that circuit can then impact stress down the line. And so that's where we're talking about stress hormones like cortisol. And GABA also plays a big part in that. So rather than get into the details of that right now, I just want to mention these two medications and what's really cool about them. So SSRIs, as we've talked about before, can take a really long time to work. So in many cases, I'm telling my patients it's going to be 4 to 6 weeks until you see the full effects of the medication. And there are some places in the literature where it says it can take up to 12 weeks to see full effect. So for somebody who's depressed, especially somebody who's just had a baby, that's a long time to wait to feel better. Now, if that's the only option we have, that's the best we can do. So let's do that. But right now, we've got some things that are going on that work much faster than that. So hormones change a lot with birth. So there's a lot of fluctuation in reproductive hormones and especially in allopregnanolone. So that's one of the steroids that has a big effect with going from being pregnant to having a baby. And those big shifts can cause a lot of problems and precipitate stress and depression. So there is a particular medication that has been approved and it is called Brexanolone. Brexanolone is an IV treatment of allopregnanolone and it impacts the GABA system. So we tend to see really fast improvement in depressive symptoms. Someone can get a 60-hour infusion, so over 5 days, they can get this treatment, and we see very rapid results in their depression. So within 5 days, we see significant decreases in their depression scores as well as their depression symptoms. That's really fast for treating depression, and it's really important if we have a mom of a new baby who's facing depression and the risks that come along with that when caring for a newborn. So these medications are really great because they're well tolerated. And even if they weren't that well tolerated, it's such a short treatment time. We're talking days instead of weeks or months. So this medication can be given over the 5 days. Sometimes it can make people sleepy. It can cause dry mouth. It can make people dizzy. Right now, this is generally given in an observed setting. So this has a special monitoring program that you have to be in. So the prescriber has to be in the program, and then they have to monitor the patient for 12 hours after the infusion. So it's pretty hard to find providers of this medication right now, but you can't dig around and find them. And there is an approval process that a prescriber can take the program and answer some questions, and then they will be able to prescribe the medication as long as they can provide the follow-up that's required, like the monitoring after infusion. There is a black box warning on the medication. This is the Brexanolone that I'm talking about. This is the only one that's approved right now. But the black box warning is for sedation. So significant sedation with the medication or sudden loss of consciousness. I didn't see the data of how frequent this is, but most of the articles that I was reading was saying this is really well tolerated. So I have to imagine it's fairly rare, but that's part of why I think this medication is in the monitoring program. So this is a really exciting thing to think about. The medication also, even though it's given for a short period of time, it also appears to be safe in breastfeeding. So they've done studies on the breast milk, and the percentage of medication that's passed through the breast milk into the infant is very low. So it's considered to be safe in breastfeeding. So these are all really great things for this medication. And this is specifically referred to in the context of postpartum depression. There's another medication that's currently in clinical trials called Zuranolone. So this medication is not an IV medication. This is an oral medication. It's given over 2 weeks. So it's a 14-day oral medication once daily. They have been testing 2 different doses of it, 30 milligrams and 50 milligrams. And so they're trying to see how effective this medication is, what kind of problems they think that they're going to see from it, and whether or not it's more effective than placebo, and how well tolerated it is. So far, the data for this also looks really good. So this is a medication that's looking for indications for postpartum depression and major depressive disorder. So this would be one that hopefully down the line we'll be able to prescribe to our patients. So with this medication, they are seeing pretty significant results within just 3 days of taking the medication. Now, in terms of antidepressant medications, this is like unheard of. We do see placebo effects within a few days, and that's fantastic. I'll take any benefit for any reason in a few days. But it looks like these benefits that people are seeing within just a few days are maintained. So they did some studies, and in one of these studies of taking the 2-week dose of the medication, 42 days later, they retained the same benefits that they had from day 3, which is really impressive considering it's just a 2-week course of the medication, and then they're not taking it anymore, and they continue to maintain those benefits. So decreased scores on the depression scale, which is what we use in studies to see how much people are improving in a more standardized way. And then, of course, with the subjective experience of depressive symptoms that the patients are reporting. About 80% of the patients that do respond to the medication go on to have just 1 or 2 additional treatments, just single doses of this medication throughout the year to maintain the benefits. This is mind-blowing, mind-blowing. I hope so much that this medication continues to show through all of the trials that it's not hurting people and it's making them better so fast, because this is what we need. We need this in psychiatry. And this oral medication will be so much easier to administer. We have other things that we're doing right now, novel things that work really well. ECT is fantastic. It's been around for a long time. It's very safe and it's excellent, but it's not so easy to get. You have to have anesthesia and you have to go to a facility that provides it. Same thing with TMS, not the anesthesia, but you do have to go somewhere, and all of that can be extra burden for the patient. Then we have ketamine infusions, so people can go and get them. There's nasal ketamine. There's a lot of different things that we're trying to do to get stuff to work. But this stuff, these steroids, the neuroactive steroids, this is amazing to me. So I just wanted to share this little bit because I think it's super exciting for our field right now. This is something to just keep in mind. I'm not suggesting that you send your clients to go ask about neuroactive steroids, but this is something to be watching. These are the kinds of things that I get really excited about and look forward to seeing more about, because somewhere down the line, we're most likely going to be able to prescribe this. Of course, with any new medication, the indications are small. We have to be very specific. We have to watch over time and see what happens. These trials have not been going on for very long, so we can't say what happens in 10 years or 20 years, even though Brexanolone is a well-known steroid, what it does, how it works, that sort of thing. But we do still have to have that test of time. But I just wanted to share this little piece because I think it's super exciting that we might have something to help our depressed patients, especially our postpartum patients with their depressive symptoms, that they get results right away and they have no side effects, almost no side effects. Fantastic stuff. Anyway, I hope you get excited about this stuff just like I do. Enjoy this little piece of information. Share your brain bites with your family, with your friends, with your colleagues. This is good stuff to share out in the world because it makes all of us feel a little bit more optimistic about what science can do for mental wellness. Thanks.